My name is Bekki Novak and I'm one of the senior occupational therapists at St Andrews. I've worked in mental health for the last 3 years, all of which has been at St Andrews Healthcare. And I suppose it's been predominantly working on the older adult ward, but also I cover the medium secure unit as well, both in the men's service. We're in a mental health unit, so we have the kind of expected presentations with mental health, but we also then have the physical health to contend with. So this can be mobility issues or fatigue issues. There can be history of strokes or dementia. So all of them come with different, I suppose, ailments and difficulties which we have to adapt our intervention for, which maybe we wouldn't have to do on some of the other wards. So I think the typical patient presentation on the older adult ward is that combination of mental health sort of difficulties, which might be around emotion regulation or risk behaviours or stress and anxiety. But then we also have the, I suppose, the things that come maybe more with age, so the mobility issues, the cognitive issues, and they're sort of areas that we really have to kind of work on in the intervention to help them and improve their quality of life. Some of the key interventions as an occupational therapist that we cover is falls management, so looking at the environment and making sure that it is suitable for their needs. Along with falls management, we look at whether or not they need things for adaptations to kind of continue their independence. So some people might need a shower chair so that they're safer in the shower. They might need different mobility aids, which kind of we look at in collaboration with physios. Other key areas of intervention would be looking at their community skills. So time management, problem solving. Other areas that we look at is whether there's any sensory processing issues. So that can often impact how they interact with the environment. So if there's anything that we can do to help that, we try and adapt the environment so they can process it in a better way and function to their optimal level, really. I suppose we have two types of patients on older adult. We have the ones which it is about maintenance, and actually our focus is on quality of life. So it would be about us providing structure to their day, which we do by offering different groups. So we have a brain teaser session in the morning, we have a balance and posture once a week, and that is just to maintain that cognitive and physical level so that they then might go somewhere like a residential home or a very supportive living environment. For the other group of patients where actually they can improve, we would offer things like budgeting or kitchen skills, or we might sit down with them and teach them about how to plan their day, how to use a diary. And I suppose once they develop those skills, they can then go out into the world and function a little bit better. I think one of the things that makes St Andrews great is, especially on Moor Green, is that we really look at our patients holistically. So we really consider the mental health and the physical health, and we make sure that we provide treatment that looks at both of those areas.